Call the meeting to order. It is 7:32 on February 10th, 2025. This is the Board of Health in the town of Fairfield. We'll start with approving the last month's meeting minutes. Need a motion to approve.
So moved.
Is there a second?
Second.
Great. Any opposed? Okay. Seeing none, minutes carried. We'll start with our Director of Health report.
Okay, so I will talk about a little bit about one of the big efforts of this past month and for the next few months is this prioritization of our health needs assessment that we did. And so this involved a couple different steps, but I was going to share not the entire presentation, but some of it about how we went through this initial stage of prioritization of the needs that arose from the assessment. So I'll just kind of scroll through here. So I think most of you know we have this group called the Health Improvement Alliance, HIA, and it's comprised of hospitals, health departments, other groups. Were you a part of it?
Yeah.
So you're familiar with it. I know everybody else knows about it. But so this is the group that conducts the health improvement, health needs assessment, and works to prioritize it. Covers these towns. And I'm just going to kind of move real quick for stuff. So this is kind of what we're following, getting secondary data, qualitative data, the Data Haven surveys, like almost a resource review of the area, serviceability research, asset mapping. And then this is the fifth phase that we're going in right now. And then it'll lead to, comprehensive community health needs assessment, and then a community health improvement plan. So that's what we're going through right now. And I will kind of skip forward some of these things. So some of the key insights that rose up, and these are not going to be surprises to anyone. Access challenges to getting health care. Some areas of our area of our towns have high insurance rates. Where the ratio of primary care physicians is a little higher than the state ratio, 897 patients to one physician, which is sort of not going in the right direction there. And that here's some of the reasons that people didn't get health care, delayed care, trust in health care. It kind of goes into that a little bit. Cost and scheduling issues were the significant barriers to timely care. If you drill down into the data, it's really just like people are just kind of, it's inconvenient, so I don't get it, I forget about it. And in Fairfield, money was not so much a barrier, and insurance wasn't a barrier because I think with Fairfield's rate was 98% insured. So it didn't come out as one of the strong points in the community well-being survey. Maternal and pediatric care came out. Again, the ratio in our area is higher than the state ratio. So I'm going to just keep moving because most of the other stuff. So this is access to services for behavioral health care. Again, we're even, in a bigger gap of between what the state has of ratios of mental health providers per patient, significantly higher there. And what came out in the community well-being survey, 15% of adults reporting needing it, but not receiving it, the care they need in the past year. And so it's some, again, this came out highlighted in a lot of them. Barriers to care here was, couldn't afford, too busy, couldn't get an appointment, health insurance doesn't pay, not knowing where. So these are some things, there's some low-hanging fruit that we can kind of work to address, and some larger scale issues of sort of changing people's perspectives on the importance of getting behavioral health care.
Suzanne, do you know, I don't really see it there, but I can see how maybe it would fall into some of those categories. Was there any look at maybe the way the practice sets up their finances, right? So, for example, their cash accepting only or their concierge, things like that. I mean, that could maybe fall into some of the, like, insurance doesn't cover it, but looking specifically at those providers of the various groups, you know, and maybe that's why people can't get in.
Yeah, I mean, this is just basically asking people to, you know, to highlight that's in there, but the percentages were lower than some of the, you know, the larger, you know, more common responses. But yes, it's in there in the terms of, you know, the providers don't accept my insurance, you know, and a lot of providers, behavioral health providers, don't accept insurance.
Right.
You know,
That's what I'm going with that, actually.
they give an
The ratio is lower than
they just hand an invoice and say, you know, you submit it, you know, and so, because, you know, and I think, you know, obviously, this is the crowd that understands that most, is that, you know, we do it here at the health department, but billing is just insane for us, you know. We spend a year to get all of our flu and COVID claims in, and then spend, you know, or about 6 months, and then we spend the rest of the year for all the ones that they rejected, going back and, you know, trying to figure those out. But yes.
I'm sorry, before you go on, do we have to let Sally in? She just texted me, she says she's...
Oh, she's probably dialing an old number, maybe. I don't know if she has.
Is there anyone on the line?
They can come in. I can text her the number.
Could you please? Thank you. She's getting tired of the jazz riff, she says.
We didn't block anyone out.
Well, make sure she's dialing the right number. We'll pause for that. Did we switch recently?
They change it every year.
Okay.
Like, they have a new company.
Hi, I don't know what's going on.
I'm sorry.
Well, so, just with,
Hi, it's Sally. Sorry about that.
Hey,
And I was
thanks.
so organized. I got it on at like 7:25, but after, 10 minutes of the same jazz riff recycling, I was getting kind of suspicious.
Okay.
Can you hear me?
Yep, we can hear you, Sally. Yep. I'm just started my presentation.
Okay.
We're reviewing some slides that were presented at the Health Improvement Alliance regarding the Community Health Improvement Plan.
Okay.
And so with substance abuse, this survey revealed, the well-being survey, that, in Connecticut, in the HIA region, 28% knew somebody who was affected by heroin or opioid addiction. Connecticut, that number is, 30% of people answered that they knew somebody. All right, we'll just keep moving here. Bridgeport's population, BIPOC population, which is Black, Indigenous, people of color, is significantly higher than the regional average. Income inequality is significant there, with 54,550 in Bridgeport, 181,934 in Easton. Big difference. Cultural competence, that people really want people that, represent the community they serve, to promote trust and equitable care. And then just, do you feel like we're treated with less respect or got lower quality care compared to others with, nearly 40% attributing that to their race and 24% attributing that to their gender. So it really brought out some issues that, are important that that the group can continue to work on. And again, I'm going to keep moving here. These are ones that kind of surprised me. Individuals who could not afford food in the past 12 months, nearly 20% in both the HIA region and Connecticut said yes. People who struggled to afford adequate shelter or housing, 14% for HIA region, 12% for the state. So this is the method, the Hanlon method is approved by the National Association of County and City Health Officials that we use to go through the prioritization. And basically it's looking at, calculating the magnitude of the problem, the severity of the problem, the feasibility of the problem. There's two. So we did all the surveys, the community well-being survey and the community-based assets and needs survey, and then, and those are, we had thousands of responses for our region, and then in addition for the prioritization, so of the people attending the meeting on the 28th of January, there was about 40 people there. We broke up into 5 groups, but 20 of the people coming there had responded to a pre-session survey where they ranked the top 10 needs for the area, and they had provided sort of a summary of the research that they had done up until that point for people to review, and then complete the survey about this. And this is kind of how it came out for these 20 responses: preventive hair program, chronic disease, stigma about mental health, and culturally sensitive behavioral health for diverse populations, some of the top ones. And then they did a survey, and I don't know if some of you may have completed this, the Community Voices survey, and it came out a little differently with, availability of mental health services for all groups. So they have a kind of comparison of the needs between the two. And there's some, crossover between the two with, mental health services being the top of the Community Voices, a little lower in the, people that were attending the meeting. But again, it did come up a couple times about, behavioral health care there. And so we went through this process, broke into 5 different groups, and then we just had some discussion about it for a while, and ranked it by this, this Pearl E method, and then we were each given sort of a topic area to kind of go through with some ideas. And I'm going to scroll down to the final voting results. So we were supposed to come down to have, they said, we really want to get down to 5. And so we got down to 10, which is, and it was, it was interesting, the groups did their report out, and the first one was like, childcare came up as affordable childcare was up pretty high up here. Mm-hmm. Yeah, second one for the larger survey. And so the first group presented and said, while we see it's an important topic, it's not really feasible for HIA to do anything significant. We're not going to move the needle on providing an affordable childcare because we're all involved in public health and health care. And so we said that's, so we didn't rank it high, because you had a pass-fail on some of these issues. Did it pass the Pearl E test? And if it was 2 of those things, you've had to fail it. Then that led to a 45-minute discussion on the need of childcare and how important it is, and all the time while agreeing that there's not much this group can do, but we need to stress how important it. It was like, okay, and the consultants were like, all right, we get it, but we got to move on. And so anyway, we worked to come up with these 10, and then the group led by the consultant worked to try and consolidate it a little bit more and combine some of these things because some of them have overlap. and worked it into some of the final categories of healthy lifestyles, behavioral health, primary care, maternal care. And then it was agreed that for the things that we can't really move the needle on, that somebody volunteered to start an advocacy committee to talk about promoting, supporting legislation that achieves those things. So legislation that looks at achieving affordable childcare. And so we kind of said, well, healthy lifestyles, yeah, we can put all these under healthy lifestyles and come up with objectives for each of these. Same here, and so it just turns out, other than we have a healthy children task force, but we currently have a healthy lifestyle with a behavioral health and a primary care or access to care task force. So it's very close to the same things we've been working on. And so that is going to sort of lead to the health improvement plan, and that will feed into our strategic plan that we'll be going through. We're coming up on needing a new one in a few months, so we'll be coming to you with that. We'll have a consultant come in and meet with us like we did last time. I think some of you were on the board at that point. And so that this information will feed into that and will be, one of the goals of the strategic plan. Okay, so I'll move quickly through state. The COVID's sort of trending down. RSV is coming down. This is in terms of respiratory virus. Flu is still going up. And so we're still seeing that. Wastewater is kind of following the trends, if you will, of what's going on with COVID-19. And then I think I'll go over to here. And nationally, I thought I'd show you this because, one, it's an interesting graphic. Well, this is going to take us, I'm going to push play, and it's going to take us from October 5th to now, and you can see what's going on in the country, and it has an interesting twist at the end. Where you see it's very low activity is green, then the purple is very high, and this is moving us through each, and you see the date there. The jumps there, then it starts to lighten, and then it starts getting dark again. So it's indicative. We started seeing some relief, and then it picked back up again. So, which is, I think, what I am sure in your practices and in your workplaces, you're all experiencing. Lots of people with significant illness.
Doesn't matter the complaint; they're all flu positive. You can come in for anything else, and you're going to be flu positive. I don't know how it's happening, but everyone's got the flu.
Yeah.
Bad this year.
Brutal. So, so I did have the opportunity to sit with the first selectman and his team to go over our budget. We're not making any significant changes, kind of moving some dollars around. And I mean, there's some increases related to collective bargaining agreements being settled and going up. And so that'll have some, impact on numbers, but that's all accounted for in the contingency funds that they had built for this year. But our budget will go up. But again, we're not asking for any significant amounts. Slight increase in our or I'll say a moderate increase in our temporary payroll, which is for our sub-nurses. We continue to see, people utilizing time for long illnesses that some of our staff that are more senior, and so they have sick leave banked for that. So then usually a lot of the staff, it balances out. They're out, but they're not getting paid, and then the temporary count gets hit, but they balance each other out. But this time, we've had a few staff out for various reasons that had time, and so we're paying them and paying a sub to work, and so that's a little challenge. So we've been running a little bit high in terms of expenditures, so we think we'll go over in that line, but we're trying to balance that out we did a multi-year average to say, all right, well, let's see what we can hone in on what the real number is. And so we upped our that account by about $13,000. But other than that, no significant changes. We did want to, I think Santino was here last time, we were talking about we're going to have one more flu clinic because there's so much flu activity. We thought we'd have another flu clinic, so we had another one on the 28th, and we had one person show up. So obviously no demand, we tried to push it out there to see, we thought, when activity's high, sometimes we get a bigger push, but.
You got one. You got one.
Yeah. So there's been some changes to the federal government in terms of grants, particularly that impact the health department. And so we've had a series of meetings with the state and communications with the state, no communications with federal officials. They've kind of stopped everything. They'll talk to a few people up at the state. What they've told us is, staff that are currently on the grants to keep them, if a position is vacated or vacant, don't fill it. Don't engage in any new contracts under the grants or subcontractors. And so we've had to put a hold on our immunization grant in terms of we have a contractor doing the media relations aspect of it. And we were largely done. That there was some leftover funds that we were going to have them utilize for a travel vaccination push around spring break. And so for now, we had to tell them don't incur any hours on our behalf. We have to pause that. We did have a staff member, concerned about the uncertainty of it, a part-time nurse on our immunization grant. There was an opportunity for a school nursing position, part-time school nursing position, so she said, I'd like to switch over if I could, and so, of course, we want her to follow her career where she wants it to go, but it was sort of the fear of, losing that job and the fear of missing that opportunity. She said, I think I'm going to switch over, so our vaccination grant no longer has a vaccinator, and so, but we have Chloe, our community health worker, still working, helping Andrea with food claims and trying to work on the submittals for that. And then we'll see what happens going forward if they let us use those funds, but it'll probably lead to a surplus at the end of the time that we'll just, funds that we won't be able to capitalize on. Our ELC grant is also impacted. We have one person on that grant, and they haven't told us to, they said staff can, still be paid, still do hours. So, and the fortunate thing is the workforce development grant, which the state already provided all the money to the locals, said that they don't think there'll be a reach back all the way down to the locals. Like they think it will only go as far as the state. And so for that one, they feel like we're okay. And so if the ELC2, they tell us to stop spending money, we have the workforce development grant that position was eventually going to transition to that grant for longevity. That would be, another couple of years for that individual. Preparedness grant, we're not sure about. Same kind of thing. They said, you don't have to fire people, don't have to stop activity, but it may end. Our per capita is not impacted at all. Those are state funds. I did have a meeting with the CFO to kind of review this and propose contingency plans if staff do have to get, we have to stop spending money. So we have some funds in the Medical Reserve Corps that the preparedness people could work on and just focus their work on the volunteer group. And so for the time being, and then we'll see what happens with that money. And then, as I said, we can switch over folks on the one person on the ELC to the workforce development. We continue to have the Safe Streets meeting. So we have the Fairfield Safe Streets Alliance is now the official name, with the tagline of changing how we view and use our streets to achieve Vision Zero is the tagline under that, and we're spending time working on now what are the sort of slogans and campaigns that we're going to put out there for social media. We're going to contract with some of the art and creative aspects of the high school programs, the audiovisual programs and creative programs, to have them come up with social media slides for Instagram and graphics. We have connections with another entity that's producing graphics, that they produce graphics and they're willing to put your name on them. And so we've got several resources that we'll use, and we'll start in a little bit. We'll have like a launch meeting, launch event, and then we'll start promoting it via social media and advertising. It just depends on the funds we can secure in the future. So, but we're working on that, and part of that group. So again, the opioid settlement funds, I'm part of the team that's working to try and lay out a plan to spend those funds and how to best utilize it, and to have people with expertise in that area be a part of that group and sort of lead that process too, so that we get insight on how best to use it. And then, I'm trying to think if I have anything else here. I don't think I did. Oh yeah, so I'll talk about, we started launching what we're calling our Spontaneous Responder series on our website. Here, okay, come on. And so we're, for those not familiar, Spontaneous Responder is a sort of a layperson that responds between the event and before a professional first responder responds. And so basically we're offering 3 trainings: hands-only CPR, AED use, and a stop the bleed combination training. We had 2 sessions on that. On the 25th, in the afternoon one, which filled up fairly quickly, and then we still have a few spaces left in the evening one. We are promoting the Hub's online naloxone administration training, free training online. You get 2 naloxone kits once you complete it, and then Santina and Julie, our public health nurse, will be offering a QPR training, question, persuade, refer, suicide prevention training on the 26th of March, right here in this room. And so this is the first 3 trainings that we're going to offer, and then we'll continue in the future with, potentially doing a full CPR class, first aid class, active shooter class. So over the next year, we'll do a series and try to cover that, and basically helping people to, be better prepared for both our Medical Reserve Corps volunteers, our staff. We opened it up to town staff. We opened it up to Medical Reserve Corps members, both ours and in the area. And so we've got about 50 people signed up so far. So it's people are responding well to it. And I think that is everything I have.
Sam, can I ask you, just going back to the grants?
Sure.
Does DTH have a sense of when they might be able to give you a little bit more clarity or concrete guidance as to?
They don't.
What to do with the funding?
It's really an information blackout. Yeah, they gave us a little bit, and then they just say, I don't know if you were on that call, but they, it's like, this is what we're allowed to say to you right now.
Right.
Is you don't have to let people go, you don't have to stop everything. But, especially at the HIA meeting, a lot of community organizations that rely heavily on, heavily on federal funds to support their operations, and they were commenting that, the portals they use to submit the financials to get reimbursed were closed already. They closed a few ones for the state too. They were telling us that. They since have reopened some of them, but so it created quite a stir and some fear for people being like, if I can't submit money, I've got to let people go today, and people were saying at that meeting. So, so a little bit clearer, and, I think the media has kind of covered that, certain programs, they weren't clear with the memo, but certain programs were exempt, and so, but not a lot of clarity that they can offer us. We're just kind of waiting.
Waiting to see.
Yeah, and so I think it's, we've already had, again, it's a minor impact for us having the nurse jump over to another job within our department, and we lose that capacity. We can still vaccinate. It's a very slow time for us as we demonstrated, so it's not a lot of demand for us right now. And the grant was supposed to end in June anyway, so it's not a significant loss for us, but, you know, it has impacted us. The state's been doing some surveys in terms of what would be your impact if, 10% of your funds were gone, 20% of your funds, 50% of your funds, what would be the impact? And so I responded to a survey that they were doing related to that, so, any other questions?
Thanks.
All right, thank you, Sam.
All right.
Rob, love to hear from you.
Sure. So since the last time we were here, we just finished up actually on the food section is doing our annual certified food managers exams that we provided a lower cost to all the restaurants. We only had 25, I call them students this time. We're coming to the tail end of our license renewals. So that's when we pull the ones that don't have certified food managers. We reach out to them. Depending on need, we may do another day of exam only. Kim in our office taught the class, and then I administrated the exam over 2 days. So that kind of worked out well, a little bit lower numbers than we normally have. Since the last time I was here, the thing that's really been keeping us busy was housing, mainly down at the beach with the rental certificates for the students. We actually received from Fairfield University back in September all the addresses of what students were giving them as their rentals. So we kind of tick and tied them, and we came up with 56 dwellings that did not have certificates of rental occupancies one way or another. After going out doing inspections, 18 of them out of the 56 just did not exist. They were open land, the houses were not there.
So we report that back to Fairfield U.
Yeah, we do. We give it back to Fairfield U and say, hey, these are 18, you can go there, there's just dirt or sand just sitting there, and they're not dwellings. They're limited to what they can give us as far as information. They do say they will follow up on their end. Some of them were currently owner occupied, so when we knock on the door, they're surprised, like, what do you mean, we're still living here, it's not rented. So we did follow up on those. We did send out orders on some of the units. They came back, we got certificates. We did have 3 of the orders sent back. We send them out certified mail. That's the way we have to do it legally. It's a very slow process. It takes a while for them to come back. So they were returned to us. We are currently reaching out to the owners, or trying to reach out to the owners to do inspections, because it hit right towards the middle of break, so no one was at the house, and it wasn't easy to get in touch with the owners, so we are still working on that. As far as overcrowding, we really didn't get any complaints for say on overcrowding. Surprisingly, this year we did have 2 dwellings that when we did, myself and Melissa did one, when we did the inspections, the landlords were there, and they just, the one that I did personally, the landlord was like, it's being overcrowded, there's 11 kids, I want them out. He happened to be an attorney, but he said, what should we do? And we told him the procedure. He did start eviction right from day one and stayed on top of them because he didn't want them in there as much as nobody in the neighborhood wanted them overcrowding. Melissa had the same situation. It somewhat went smoothly in the fact that there were rentals that were available, so those tenants did move to other dwellings. We were able to inspect them and give a certificate of rental occupancies. Beyond that, we haven't really had many overcrowding down there. We also received a request from Fairfield Beach Road Association on 4 units right before SantaCon, and the requests were for the SantaCon houses, I guess you can call them, more on the beachfront, the party area. We did make sure a couple of them were inspected, and we were waiting on paperwork for them. We did get the paperwork with all the tenants, all the payments, and the ones that were not, we did contact the owners and do the inspections so that we can get the certificates in place immediately. As far as that, that's all we could really much do as far as the rental houses down there. So that's what we've been working on as far as rental houses. And another thing too, back, I believe it was in December, Allison from Social Services, I brought reports to you before about hoarding and, different type of investigations we do. So Allison from Social Services, I'm always in contact with her when we do have hoarding situations. We've been fortunate enough that we haven't had some, at least in the last 2-3 months, but she had this she didn't really give it a title yet. It was the first meeting, and there were representatives from the selectman's office, there was a social worker from the police department, the library, there was many departments that came in there, and she wanted to have a discussion of who do you contact first? Because it's always a question of, okay, we show up, it looks like it's a huge problem, but does it rise to the level of, unfit for occupancy? Who makes that decision? So Allison put this together so all the departments can bounce off ideas, because normally it's either fire or police get an emergency call, then we'll follow up on it. But sometimes police get the call for a wellness check, and they call us thinking that we can deem it unfit for that individual to live there, but we can't, because the plumbing's working fine, there's heat, there's smoke detectors, there's paths for them to get around. So she did put that, I guess you could call it a task force together, or, at this point, we are going to meet in the future quarterly, just so that we can identify things that we may see, or even if somebody at main library CSUN calls us and says, hey, this individual is coming here, who should follow up with that person, because they're looking to stay here because there's heat, but then they say they leave for the night. So she did put that back in the summer. We are going to meet in the future for things such as hoarding complaints. You're going to do the letting and new business, correct?
Yes.
Okay, so.
And you should tell about the other one that we spent a lot of hours on, the two-family down there,
The two-family,
Fairfield Beach Road area.
refresh my memory.
So it was, we received a complaint regarding an alleged overcrowding, where the owner had put his name and his daughter's name
Oh, yes, I'm sorry.
on the legal records that they were both owners. And so there's a situation with when you have a two-family home, or an accessory apartment.
It was an accessory apartment, and it's a single-family house with an accessory apartment attached to it. So the neighbors were complaining about it, but they were more going to zoning. We contacted the owner, and he got certificates of rental occupancy, but you're not allowed to rent an accessory structure unless the occupant lives in the main house. So he had the main house rented to 5 students, and then he had the accessory structure rented to a single dad with 2 children in there, but you're also not allowed to have more than 2 by zoning code in the accessory structure. So we had to do investigations in the morning, basically go down there, check for cars, so forth and so on, because the owner was saying that he could legally do it because his daughter was a Fairfield U student, and she was renting there.
She lived there.
She lived there. At little investigation, she was living on campus, and she was part of one of the sports teams. We were in contact with the owner, constantly stating that the certificate of rental occupancy application was falsified, which is what he did. Working with zoning, the neighbors down there were very adamant about, this should not be rented. So unfortunately, I had to go down there really early on a Friday morning, knock on the doors, 5 students, and I just explained the situation to them. They're like, look, we don't want any problems. We don't know what he's doing. But we spent a lot of time on it,
He eventually admitted his daughter doesn't live there.
And unfortunately, the gentleman in the accessory structure kind of just said, I'm out of here. And
Yeah.
he moved.
He asked him to move out, and so he did. But that was a lot of man hours on that one.
Yeah, it was.
That was a lot. A lot of long, complicated emails and back and forth, so. But just to give you an example of the stuff we
Yeah.
what we.
I mean, with the plan reviews we're doing for all the new apartment buildings coming up, housing could take up a lot more time in the near future, because every week it seems like we get a different building of 10, 15, 50, 100, 200 units, so.
And so the town has applied, you've probably read in the papers, a moratorium on building, which they are likely going to be granted because they meet the criteria. But anything submitted, any plans submitted prior to that moratorium going into effect still have to be considered. So all the developers are racing to submit plans very quickly to, for all the different multi-unit apartment buildings that they want to build in town. And so the zoning officers, zoning director said he expects a few more to be coming in for large.
Yeah, I mean, we
housing projects.
received, I think, 4 in the last 2 weeks. So they're just, I don't know if they're all gonna get built immediately, but they just want those approvals.
Yeah.
And there's a lot that are coming in potentially.
All right.
So, as far as my report, that's it.
That's it.
Maybe it was the last time you were with us, you mentioned a rat problem down like the beach area. Just wondering if that kind of resolved, or if it's still ongoing down there. I forget which roads it was, it's definitely the beach area somewhere, right?
It was more towards, trying to think.
Sanford Street area?
Sanford Street area. We haven't had any complaints about it, about rats. I mean, I saw something on the news actually, now that you bring it up, that because of the cold temperatures, that it's reducing the rodent population a little bit because it's so cold out. I don't know how true that is, because we've been trying to figure out why the rodent population has exploded over the last couple of years, but we haven't had any complaints. Those complaints usually will come in springtime, summertime, when people are outside and they see them running around, but we haven't gotten any complaints since then, so.
Okay. Cool, thanks for your report. Any communications?
I have none.
Any old business?
We have none.
Any new business?
So Rob and I were talking, and so we submitted something on the agenda, but in looking at the language of the code, we've got this code, section 6.16 in our current code that has essentially some old references. There's been a couple updates to the public health code regarding lead poisoning in the past few years, and so we really haven't, we don't use this much. We mostly state regulations, but there's a caveat in here that we keep in the local that we have the ability to compel the owner of the dwelling to conduct the testing, and so, which a lot of departments don't have. And so we get so few of them that we often take advantage of that and just say, all right, you know, we've got a blood lead elevation, you've got to test your house or test your rental property and figure it out and get us an abatement plan. And so, but some of these references here are just old, and so what we're doing is essentially just removing the language that is out of date, you know, that you know, I looked as best I could to find Chapter 63 of the Social Security Act related to lead poisoning, and I could not find it. I think maybe it was back there at some point when this was put into effect. You know, I think this initially went in like 1992, and so, but that there is no section, Chapter 63 of the Social Security Act. There's Chapter 63 of the Lead Poisoning Prevention Control Act. So either it's an error or it's changed over time. And then some of the numbers that they put in there in terms of parts per million for soil and the 15 parts per billion for water levels, we don't actually need that in there, and I'd rather take it out in case, because the feds are going through a process of changing things. I'd rather just take it out and say, refer to the state statutes and state regulations and just keep it cleaner that way, so we don't have to update it there. So it's essentially the yellow part is what we're removing from this code, just to kind of update it and streamline it and make it a little bit more clean. And so I'm requesting the motion at the top there to put this into place.
So I'll make a motion to so we're going to remove everything that you highlighted in yellow. We're going to take that out from the code.
Yep.
All right.
And it'll look like the code 616 at the bottom.
And for a second. Any further discussion?
Since, just out of curiosity, a 6-year-old child, is that an arbitrary age that we've chosen, or is that?
That's been in the code for quite a while, and that's, I think they said, sort of the tail end of PICA,
Right.
of kids putting stuff in their mouths, and that it's, you know, the child's brain is further developed at that point, and that it doesn't have as significant impact over 6 that it does as an under 6, is I think the rationale behind that.
Makes sense.
You just think about your maybe developmentally delayed kids that might still be doing things like that, and if that gets caught, then are you not compelled to act upon that because the age is here so specifically, you know?
It limits us in terms of the enforcement, because it says we can only do children under 6.
Right.
So, but, you know, we can, there's children under 6 is the first priority, then in the regs it says, then you can do other, you know, if you find it in a dwelling, then you can do it, and there's other children there, you can do it in other dwellings in that structure. And so there's some leverage that we can use in the regs to compel them to do it, you know, to take care of it, you know.
Hi, this is Sally.
Hi,
I do want to pipe in, as I've been seeing a couple kids with lead poisoning in the last, for the last year. So definitely it's like a very important thing to me because I can see the effects directly. And I would agree with what one of you mentioned. I couldn't hear who, but just like certainly above a certain age. So I definitely think it's important that there is some sort of provision to expand when necessary. I mean, I understand the, neurological development and kind of timeline, but certainly, I can think of many kids I've worked with who are far above that, who are mouthing everything, and like kids who've like been biting on windowsills and, even at a much older age, just because of certain perseverative behaviors. So, anyway, just my 2 cents. So, but I see that it sounds like a lot of the corrections you made are more like editing, kind of errors that you found. So.
Yeah, it's editing and updating. The numbers now are more stringent, and so we don't want ours to be in conflict with that. Even though the state's ones would always trump ours because they are more stringent, but we'd rather have the language just be clean.
Are you trying to say something?
No, that's, because here in the state of Connecticut, we only have to test for lead at ages 1, 2, and 3.
Yeah.
So it is kind of interesting.
But a parent could come.
Oh, yes.
Right, and
Yeah.
request a blood test, especially if they live in older housing stock.
Yeah.
Exposure.
So I wonder if it's better to take away a limitation and increase it to, 17 and under, just to give the town that flexibility, if need be.
We'd have to talk to the town attorney on that. The lead regs at the state are pretty strict and pretty, have been in place for a long time, although they're updated, I don't want to say frequently, but they are updated and they've been getting stricter and stricter, but I haven't heard any discussion of that.
So this actually mirrors the state regs then?
Exactly.
Okay, I see.
Yeah. It's the state, we're basically following the state regs.
Okay. Any further discussion? All in favor?
Aye.
Any opposed? Okay, seeing none? New section carries.
Thank you very much. Appreciate it.
Any other new business?
We have none.
I'll entertain a motion to adjourn.
Motion to adjourn.
Nobody wants to do it, they just want to stay.
All right. Any opposed? Hearing none, we are adjourned at 8:21.